Welcome back to our channel, Libra Aesthetics and Wellness. I'm Aisha Thomas, MD, the Medical Director.
And I'm Lisa Parker, nurse practitioner.
And today's topic is healthy hormones. So if you want to hear more about this topic today, then keep watching. So today we'll talk about what hormones are. We'll talk about what impacts hormones. We'll go over where in your body you can find these so-called hormones. We'll talk about some vitamins and supplements that can be useful in helping with regulating that. And we'll talk about our program here at Libra Aesthetics that can be helpful to you. So I guess first off, we'll just mention quickly what is a hormone, which we know is a little chemical messenger that goes around your body to, bring a signal from one part of the body to the other. So I'll go first with Lisa, going over the general overview of what the hormonal system does, where it's located throughout the body, and then we'll go back and talk about a little more specifics.
Well, so hormones are made in all kinds of glands throughout your system. So it's called the endocrine system. It's actually one of two major communication systems in your body. The other one is the nervous system. And they're located throughout your body, all over. So we start at the top. You have your pineal gland, which is great for your sleep cycle. We have the hypothalamus, which is great for your nervous system and hormone balance. Your pituitary gland, which is good for reproductive growth, hormone regulation, childbirth, things like that. You've got your thyroid and parathyroid, which is great for your metabolism, bone health, and calcium and vitamin regulation. Let's see, we'll move further down. We've got your pancreas, which is great for your insulin and blood sugar control. We've got your adrenals, which are great for stress response, blood pressure, kind of salt balance, blood pressure control, things like that. You've got your ovaries, which are great for female characteristics, and you've got your testes for male characteristics. That's a broad overview. Each one of these throughout your body release hormones very specific to go, the end target. They can either grow cells, release other hormones, perform functions just for normal homeostasis, which is actually just balancing the body, or perhaps sometimes they get out of balance, which can cause havoc on the body. So sometimes when people say that they're having issues with hormone balancing, we're here to help. So
Exactly.
Yeah.
Thanks, Lisa. Because the thing about hormones, which I think is interesting, is that they also speak to each other.
They do.
Now, the thing about the endocrine system that we mentioned here is that it communicates on a whole. So that a problem with one organ system affects the other.
Right.
So that you might find that many things can impact on one thing, and then it becomes a domino effect. So I'd like to mention a few things that can affect your whole hormonal system altogether. Because as you know, it controls many things. We always talk about mood, because first of all, many of the hormones impact on our mood.
True.
Okay? Because you know that a lot of times they're precursors, or they also impact on the neurotransmitters, which we mentioned here. Of course, they go throughout your nervous system, and that helps to regulate how you feel. Of course, it stimulates your sleep, because you know how sleep, we talked about the stages of sleep, and I was saying to ourselves, we need to do a whole topic just on sleep, because that's
right.
vitally important. Because it's it's vice versa. Sleep impacts your hormones, and your hormones impact your sleep as well. Another thing is even just your appetite, because your appetite is affected by your hormones. And that's another thing, because last week we talked about healthy weight, and then the appetite plays into your weight as well. We talked about, you mentioned two things. You said your pituitary gland, you talked about the ovaries and the testes. And of course, these are all connected with the sex hormones.
Right.
Because they all sort of speak to each other. And then we talked about even digestion, because when you mentioned the pancreas, and even throughout the intestine, there are different hormones that speak to each other that help to regulate digestion here. And we talked about cognition, which is just how you think. We have a program with Healthy Mind, and just how you think and how you process information is impacted on by hormones as well. So, and with them speaking to each other, and with each of them having a whole pathway, it's just a vital thing to think about. And another thing I think about with hormones is that each of them could be a little bit act differently. For example, when you think about the thyroid, we do certain labs, of course, to check your thyroid. Well, certain thyroid hormones are more active than others. For example, we check, for example, the T3 is even more active than the T4, which are labs we check often. And for example, if we check, let's say, the TSH, which is a stimulating hormone,
Right.
because it's like one thing leads to the other. We have a stimulating hormone, then it goes to a releasing hormone, for example, and it goes into the end organ, and that releases another active metabolite or product. And for example, when you talk about like the ovaries, the most active, for example, estrogen is the E2, while it's not the most common one. You know that the E1 is the most common estrogen.
Right.
So it's just the body is so complex, it's just so important to think about that. So please tell us a little bit more overall about hormones and from what you found important.
Well, I guess what I can say is, besides the fact that they really do impact one another, I love the fact that when we know the pathways of the hormones, we can actually delve into it and figure out where we can impact the pathway. So I think that's what I love about it. It's like this big jigsaw puzzle. So we know, the progesterone pathway, we know the testosterone pathway, the steroidal pathway. So you figure out how far we can get to, and if you're having some kind of imbalance, we can figure out what kind of supplements that we can get in there and really regulate your body and get you performing at the best that you can perform.
I like how you put that, because for example, let's say you have a pro-hormone, let's say you think of DHEA, something that's a major first component. And it might start with cholesterol, for example.
Right.
Cholesterol might be the first thing that even becomes the precursor of all the hormones. And from there, it depends on which pathway it goes down. It may go down into, for example, the estrogens. It may go down into the cortisols. If you're really stressed out, then you might find that that the hormones are going down into the pathway of making more cortisols. These enzymes are more active, and that we may need to actually help to transform them into the more estrogens. And we may find that, for example, in men, their estrogens are being, for example, their testosterones are being transformed into more estrogens. So we now have to say, you know what, we need to tweak that pathway and send it back
Slow
this
it
way.
down.
Yeah, so you're right about it. It's very scientific, and knowing those pathways, we can tweak it and see what each person may need accordingly. So I think that's why we need to talk about what things can impact those, because we found that there's certain things. For example, we talk about the plastics. Growing up, we know that, for example, 90% of the population, we find in their urine we have that bisphenol A, which that BPA has been, they've been exposed to, and it's in the urine, and it's in the plastics. It's been exposed in breast milk, and we find it can be, given from mother to child. And even now they bring in the concern about the plastics in, for example, masks, because now we're all wearing masks and we have to breathe that day in, day out, and what's that doing to our systems now? We know that there is pesticides, for example, that have toxins. And these are the things that are stored in fats. And we know that a lot of hormones have that fatty tail on them.
Right.
And so they're affected a lot when you have those toxins and those disruptors. So that's something that I think we need to look into. And when we talk about even medications, different medications can certainly impact how the hormonal pathways are affected. So that's why when we, for example, if you come in for a consultation, the first thing we'll do is go through your medication list, go through the symptoms you have to sort of see where along the pathway you are, what is really being, what is the imbalance? Because we do know that so many things impact each other, and we're trying to find out where is that little key we can fix to get you moving along the right path and sort of transforming things.
Right.
Has that been helpful in what you found when you've been practicing with patients, Lisa?
I think so. I think listening to the symptoms and trying to really understand what it is that you're feeling, and how you're being affected, to try to really kind of hone in on what the lab work is saying, what words are coming out of your mouth, and the things that you're experiencing, and trying to piece all of that together, and just adding different supplements and just trying to tweak it to get you to feel better. Because really at the end of the day, it's really about controlling your symptoms and just really having a great quality of life.
Yeah. So I guess let's just go over a few things that we can do just to help someone if they mention they have certain things that we know are along the trajectory of hormonal imbalance. And sometimes, Liz, the best things in life could be free. You know, you can just start with the basics. We tell you what. How much water are you really drinking?
Water, exercising.
Yeah,
right.
because we say, you know, why do you need to drink water? Because you're really trying to flush your system. A lot of times I mention the toxins you've been exposed to, you want to get rid of those. So I say 2 liters. You want to get in, if we know you have normal renal function, we want to get in some, 2 liters of some good water in you to help you to sort of start to detox.
I can be honest with you in saying a lot of times that I speak with our clients, I am very surprised about how little water people drink when you really start to speak with them about it. It's amazing.
I think you have to be intentional, because I think about myself in a busy day. You'll just be surprised and say, you know what, my mouth feels dry right now.
Right.
Did I even drink enough water?
Right.
So
and
yeah,
I think I find myself asking patients to ask themselves, or clients as well, ask themselves, are you really hungry or are you really thirsty?
Good
Think
point.
about how many times did you really grab that cup of water or glass of water today?
Okay. Good point. Now we mentioned the foods. Of course, you're going to diet.
Right.
So a few things I'll say. We mention that sometimes. Of course, it's the sugars, because think about what are the
There's
building
so many
blocks.
words
Yeah.
you can use for sugar.
Right. Yeah, it's true. The building blocks of what you're trying to get into healthy hormones. We talked about the fats. So I feel like the healthy omega-3s, we keep talking about those.
I know we do.
Yeah, because remember, they sort of are the building block of, getting those healthy hormones. So you want to have the healthy fats in your diet. That means you want to avoid the trans fats, right?
Right.
So that's the processed foods, because many of the processed foods, what they do is they take the fat, which might be a polyunsaturated fat, and they sort of try to make it more robust, and they will link it together. And that's not healthy. So that's one of the things I try to avoid. Another thing you might want to avoid, of course, are the refined carbs.
Right.
Those don't have a lot of fiber, and these just add on, too many calories as well. So it all goes together. And with the exercise, the particular one we like to mention, of course, the high intensity, the high intensity, because it really puts you in that your body in that frame where it really is burning at an optimal way to burn off fats. And it just also helps you to really, push your system into developing enzymes. So I feel that's a good way too.
That's excellent way.
Managing stress is one way that you can help with your hormones. I think it's easier said than done, because going through a stressful position myself, it's something where you have to be really mindful to sort of just sit still and not let your mind overwork, because it's like just trying to focus on one spot. My mind will start going haywire already. Just trying to
do that?
It's really hard. It's really hard, I'll tell you. And just trying to do a little meditation and just thinking of one thing at a time, and just trying to get your parasympathetic to be in balance with your sympathetic nervous system. Because we mentioned that fight or flight.
It's true.
Your sympathetic just wants to take over and wants to protect you and feel like a lion is coming out to eat you.
Right. And everyone's kind of been experiencing it, whether it's someone knows someone who's been sick, out of a job, can't go out anywhere. What are we going to be doing? You feel closed in, boxed in, reaching out. You haven't been able to, it's really hard time for people. So yes, I think you're right about as far as easier said than done for this moment in time. But, just taking a little bit of time just to meditate, just a few minutes for yourself, and just be still for a couple of minutes. I think that can absolutely help out.
Yeah.
5 minutes goes a lot longer these days than it used to, I think.
Probably. And then one more thing, going back to the diet, try to get yourself your protein and your fiber.
Oh, yes.
These will be good. So let's go over the diet again. Just remember, you want to do less refined, less processed. Get your water in. You want to get your omegas and your good fats. You want to get your proteins in and your fiber. It sounds like you want to do some greens, right? With that. And if you do that, you really, and you work on those things. And what we told you here are things that, as I said, you don't need money to buy those.
No.
We're giving you stuff that's free for now. Try to work with that.
Right.
Okay, so now let's get into the supplements. I feel like that's always something we might mention, because with today's diet, it's hard to always get things that would be as nutritious as we'd like.
That's true. So we talk about your high stress levels, and think about some ways you can kind of support getting a little less stress is some vitamin C, and also taking calcium and magnesium. But you should take these at opposite times of the day. and taking some B complex, especially when you have some kind of surgical stress going on. And also, green tea increases your serotonin and your dopamine levels. So, kind of relaxing you, but making you feel good all at the same time. And once you feel good, how can you be feeling stressed, right? So, I think, right? I mean,
True.
you're feeling good. You're not feeling too stressed, just relaxing,
Yeah, a couple of things for women I mentioned, which could be helpful. I say dim.
Dim, yeah.
That's a good one for
I should have
estrogen.
put that on the list.
Yeah, that's a good one for just estrogen balance overall, because as we women go for such cycles. The women's cycles are so complicated, and it's really interesting to see how you go with those surges of different hormones, and some are high, some are low at different times of the month.
Right.
So I find that DIM really helps with just balancing that estrogen metabolism, and it's good for menopausal, premenopausal, at any point.
Right.
And that's really nice to just keep you nice and stable. And another thing that could be helpful is the maca root. That's a good one that really helps with just overall, hormonal health for men and women, for that one.
Maca root?
Mm-hmm. Okay. That could be a nice, useful one there. I think that could be nice. I like how you mentioned the B vitamins. And another one I'll mention is glycine. Mm-hmm. Glycine is an amino acid. That one is also an inhibitory neurotransmitter. So it's really helpful for mood and sleep. So that one is nice to just overall help you with your hormones, your mood, and your sleep. So I think along with a good diet, those few supplements could be something you can consider.
I like it.
Mm-hmm. I think as we go forward with more program, as we go forward with more Wellness Wednesdays, we'll delve into detail in some more of those hormonal systems for you. We'd like to take your questions, of course. You can leave them down in the description box. And of course, down in the description box, you'll find our website. You can always schedule an appointment with us. You can call us. We're always we're happy to. You can email us. We're happy to reach out. You can get us on Instagram, on Facebook.
Yeah,
we out here.
We're trying to be everywhere.
We're out here. You can reach us.
Right.
And it really is our pleasure. This has been really great getting into wellness. We're passionate about it. And as you know, it's Libra, where we're all about inner and outer beauty. So thank you for joining us today.
Thank you.
Have a great day. Happy Wellness Wednesday.
See you next week.
Thank you.